Hello everyone, welcome to sqadia.com, and in the fourth section of our lecture topic abortion, we will talk about some sequel of abortion. In this sequel, we will talk about what are the complications of abortion and how the patient with abortion is follow up, and then some post-abortal contraception methods. Complications of abortion are failure to end the pregnancy. Sometimes even this is sometimes common, especially in the late gestation, that even if doctor tries to abort the pregnancy or abort the fetus, the pregnancy still didn't end and the fetus continue to grow. That's the one complication, which is failure to end the pregnancy. Then the other can be incomplete abortion. In incomplete abortion, the product of conception still stays inside the uterus, and this needs further treatment by dilation and curettage to remove the product of conception. And if the product of conception are not removed completely, or if they stay inside the uterus, then infections are very common, and then off and on vaginal bleeding and spotting is also very common. So with this complaint, when the patient comes and doctor do the ultrasound, usually they see some product of conception still inside the uterus, and for that usually dilation and curettage is performed. And then infection and hemorrhage is also very common complication after abortion, especially if the abortion is done under unsafe conditions. Sometimes self-induced abortions or abortions done at home without any special care. Usually infection and hemorrhages are very common complications of those type of abortions. Follow-up for patients with abortion, usually if everything is done safely and a product of conception are all removed, usually no need for follow-up. Good, usually you tell the patient if they have any problems, or if they have any pain or fever, or if they have any spotting or bleeding. Always explain them very clearly that they need to come back and see the doctor, because there might be something going wrong, or might be some infection going on. Or the other important thing to talk about, if they want to have a pregnancy soon, or they want to do some gap in between, if they want to use some contraceptive methods, there's other thing that you really need to talk to the patient, that what type of contraceptive methods are good for them, and what type of contraception they should use, and how long they should avoid another pregnancy. So all these things are very important to talk once the patient, you are dealing with patient of abortion patient. Some post-abortal contraception methods that are safe and good after abortion is, one is LARC. LARC is long acting reversible type of contraceptive method. Long acting reversible contraception, in which usually implants are available, depot injections are available. So all this is long acting reversible contraception, implants and injections. And then other methods of contraceptions are also there, in which there are combined hormonal pills are available, IUDs are there, And then you have condoms available. Condoms are very effective, especially for protection against sexually transmitted diseases. Then there is withdrawal method, and also spermicides are usually used along with IUDs and other barrier method of contraceptives. In the barrier methods, there is ring, diaphragm, is the barrier method of contraception, and spermicides are used along with barrier methods of contraception. So always talk to patient about contraception after abortion, because they need time to recover both physically and mentally, and it's good to have a safe gap between the after abortion, safe gap between the next pregnancy. So that was all about the complication and follow-up of the patient with abortion. Thank you for watching sqadia.com.